The town of East Gwillimbury is a thriving, growing community located just a 40-minute drive straight north of Toronto. Provincial Highway 404, which runs from Toronto to East Gwillimbury, is currently being extended through our community. Our residents enjoy all of the amenities of the Greater Toronto area within an easy commute. Professional sports events and major cultural venues are just a short driving distance away. GO trains, GO buses, local transit service, and easy access to major highways means East Gwillimbury is in the middle of it all. Look around and you'll find all of your shopping needs easily satisfied. You can purchase goods at internationally known superstores or select fresh produce right from the farmer. You can watch a blockbuster movie at a famous player's 12-theater cinema or enjoy a hayride at a community event. Shop at our new Lowe's home improvement store or fish from a riverbank. You can ride a Ferris wheel or hit a ball at a championship golf course. Zoom out just a bit and you'll find great bookstores, regional shopping malls, patio cafes, coffee shops, superstores, specialty stores, and state-of-the-art Viva buses. Oh, did I mention the traffic jams and the congestion of the city? You'll be leaving those things behind when you come here to set up your practice. Small town living, urban amenities without the crowds, everything within easy reach. It's the best of both worlds. That's East Gwillimbury. Our local hospital is the 421-bed South Lake Regional Health Centre, located in nearby Newmarket, just 6 kilometers from our southern border.
We have developed a regional program in cardiac care, cancer care, perinatal care, child and adolescent mental health and eating disorders, and thoracic surgery. So from the little York County Hospital that we were when I was born here a little while ago, the hospital has become a major referral center for the entire region, and we have a staff of 365 physicians, nurse practitioners, midwives, dentists. The medical staff is very comprehensive. We have over 160 family physicians affiliated with our hospital now. They don't all work in the hospital, but they send their patients here. They use our diagnostic imaging facilities, and of course they refer to all the fantastic specialists who have come here to work since we have grown over the last 20 years. And I think anybody that lives or drives by the hospital these days is amazed at what has happened here. The campus has doubled almost in size, and I don't mean necessarily that we occupy more footprint, but the buildings that have been added. We have now a beautiful nursing home on the hospital campus, the beautiful medical arts building right across the street, connected by a bridge where physician offices can set up. Education center on the top of the medical arts building for auditorium type presentations and numerous meeting rooms. One of the most exciting initiatives underway at South Lake right now is the development of our regional cancer center. We will be a full scope regional cancer center within the next 2 years. We'll have 4 radiation bunkers where we can provide the only element that's been missing from our cancer program. We've had a busy systemic therapy or chemotherapy program for many years, but the addition of the radiation bunkers will provide that element of care that patients have been driving to Toronto, either Sunnybrook or Princess Margaret for many years. There's going to be a beautiful outpatient facility built on the south part of the campus. It will accommodate over 83,000 visits a year for cancer patients and their families. We've added a parking structure so that once you're here, you will be in a sheltered environment, indoor parking, and a bridge to the cancer center, bridge to the medical arts building to see your family physician afterwards, and bridge to the hospital if you need some kind of diagnostics that's not available in either of those centers. I've been a family physician practicing at South Lake Regional Health Centre for 20 years. I had my family medicine practice in East Gwillimbury for 18 years, and I was fortunate to practice in 2 different locations in East Gwillimbury. I worked in Holland Landing for 10 years, and I worked in Sharon for 8 years. I was the first family doctor to practice in Holland Landing. We're hoping that several more physicians will come to serve the growing population that's coming to East Gwillimbury. The opportunity for a young physician or for an established physician who wants to start a different lifestyle is going to be wide open in the East Gwillimbury area. I think the best thing about practicing in East Gwillimbury has been the array of lifestyles that are available, whether you want to live in the villages, outside the villages in the rural areas, or whether you prefer an urban or suburban lifestyle. All of that is available to you within a half-hour drive. And with the hospital just to the south of East Gwillimbury, providing a full scope of services for all age groups, the supports for physicians to be able to provide what their patients need with diagnostics, with specialist referrals, with surgical services is unparalleled. I think it's a very, very unique situation that you can live in a beautiful pastoral rural community and have tertiary level hospital services 20 minutes away.
The town of East Gwillimbury is designated as an underserviced area by the Ministry of Health and Long-Term Care, and therefore physicians like yourself looking to establish practices in our town are eligible for the Underserviced Area Grant. Ministry of Health and Long-Term Care website will provide you with all the details. Physicians who locate in East Gwillimbury find that their caseload develops quickly into a full practice.
Opportunity for involvement in hospital work at South Lake is varied and can be customized really for the physician's practice that they want to develop. We have opportunities for our physicians to be involved in operating room work, even high-end cardiovascular surgery assisting. Some of our physicians have had some special training from our surgeons and do that very technical work, which is exciting and adds an incredible dimension of depth to their practice. If physicians have some training in emergency medicine and would like shifts, we can provide them with emergency room work. It's not an obligation to practice here. We encourage our family physicians to look after their newborn babies in the hospital, but we have a very experienced, very energetic group of pediatricians who are happy to take on that work if you prefer to stay in your office and manage the practice from there. We have a very committed group of family physicians who look after the patients on our complex medical rehab ward. So they have an opportunity to practice inpatient medicine in a slightly lower acuity setting, but provide that continuity of care for patients who are moving from acute care into a more complex care environment, potentially out to long-term care or to home after a period of rehab. I think the opportunity that is really special about practicing primary care in East Gwillimbury is going to be that the physicians will be able to come here and, based on their comfort zone, their training, and their patients' needs, they can customize their practice to all of those things. Their level of hospital involvement is completely optional, and we have family physicians who are very connected to the hospital but never come here. All of the work that they do is office-based, possibly long-term care home-based, and some patients, of course, require care at home. So a lot of the family physicians are completely fully occupied with that part of their practice, and they don't have time to come to the hospital, and the hospital is here to serve their patients when they're not here. We have a very, very busy emergency department, and the specialist backup is there to take care of their patients when they're not available. We can help them look after their newborn practice by referring those new babies to the pediatricians when they're born, and then discharging to the family physician when mom's ready to go home. I think the real advantage of coming here for a new doctor is they will be able to follow up on the kind of practice that they want to design for themselves. Some doctors like to provide urgent care and walk-in care, and there are opportunities to get involved in providing that type of episodic care to patients who don't have a family physician. and there are shifts available in some of our local walk-in clinics. We, of course, encourage our family physicians to group up and have a lifestyle that provides the care their patients need, as well as providing the lifestyle that the physicians need to stay in the profession long term.
Medical facilities or clinics are currently located in 3 areas of our town: Mount Albert, Holland Landing, and York Medical Center, located at Yonge and Green Lane within the Loblaws Superstore. There are also several long-term care facilities in the nearby communities. While you may want to join an established practice and work with other physicians, if you wish to set up your own practice and work from your home or convert a private residence or commercial site to accommodate professional offices, our friendly planning staff will provide assistance. Our 92 square miles offer great leisure activities, from golf to world-class equestrian centers, forests, festivals and tours, marinas, fruit and vegetable farms, hiking trails, wineries, antique shops, live theater, artisan studios, galleries, pubs, inns, family entertainment, and musical performances at the world-renowned Sharon Temple. We are located along the main OFSC snowmobile trail network, and we're in the heart of the Lake Simcoe watershed, with rivers and waterways that connect with the Trent and Severn Canal systems and Georgian Bay. Nearby galleries such as the famous McMichael Canadian Art Collection, fine dining, family restaurants, and Paramount Canada's Wonderland complete the picture of an ideal place to raise a family. Educational opportunities abound, with public schools, Catholic schools, French immersion, a Montessori school, a number of daycare centers, including 2 attached to elementary schools, and we're in close proximity to several nationally renowned private schools. There are many places of worship, and with over 40 volunteer community groups offering a wide variety of activities, you'll never run out of things to do. While our community lifestyle is wonderful, we know that many communities offer a similarly comfortable hometown atmosphere, but our town is unique. We are poised for significant growth in the years ahead, particularly given the direction of the Provincial Growth Plan and the additional population and employment growth forecast for the region of York.
So East Gwillimbury then, at the northern part of York Region. This is York Region within the context of the Greater Toronto Area, being north of Toronto. Over here is a map specific to York Region, indicating an overlay of urban area and non-urban area where there will not be growth. Urban area being pink on this particular map, and green indicating the Greenbelt areas and the Oak Ridges Moraine area of York Region. In the south of York Region, just immediately, Toronto is south of Steeles, north of Steeles is York Region. We have the town of Markham, the town of Richmond Hill, the city of Vaughan. North of those, the town of Aurora, the town of Newmarket, and here we are in East Gwillimbury. These white areas on the map are areas designated by the province for future growth. There will not be growth of any significance at all in the green. There will be eventually urban growth in these white areas. Vaughan has an extensive white area. Markham has an extensive white area. East Gwillimbury has an extensive white area. As I had said earlier, East Gwillimbury is a population of about 22,000. It will be growing to about 150,000 people, and that will be occurring within this white area. The pink here is Queensville. It's a new town, planned as a new town. Sharon is the buff area. Holland Landing, River Drive Park is this particular buff area. These will be filling in. That will be occurring over the next 50 years. Most of the commercial growth will be occurring on what we call our corridors along Green Lane and up the extension of Highway 404 as it's extended up into the south side of Georgina, and eventually bypass that will be connecting Highway 404 across the northern end of the growth area within East Gwillimbury over to Highway 400. We are in this building, the Civic Center, in the center of Sharon, the community of Sharon, the old village of Sharon. The hospital, South Lake Hospital, is right here in Newmarket. It's accessible from East Gwillimbury, almost anywhere in East Gwillimbury, in a matter of minutes.
Searching out innovative energy solutions, providing leadership in the reduction of waste, and taking bold steps to demand that new growth reduce its impact on the environment and celebrates the pedestrian and cyclist way of life means your new community is a healthy community.
One of the great things about the town of East Gwillimbury is we're going to remain about 75% of our land mass green. And in a community that's so conscientious about our environment, about our natural heritage, it really gives us an opportunity to plan a complete community. This community is about people. East Gwillimbury is a place where you can live, work, play, and raise a family. You should have the opportunities to do here what you could do in any large city. And that's what this council is focused on doing. One thing that East Gwillimbury has always prided ourselves on is we don't look at our community growth in numbers. We look at the assets and the experience and the quality of people that we'll have coming to it, that will share in this adventure or this journey in making this community what it should be. Having a healthy community, having one that's focused on wellness, one that's focused on personal growth, that's important to us. Again, if we want to be the best community in this country, there's a number of things that we have to do that are very important. It's not just about roads, water infrastructure, sewage infrastructure. It's about building those connections so that people have a place that they feel comfortable, they feel safe, and they feel that they can prosper not only for themselves but from their friends and families. And that's what we're all about. Our Energy Star policy has been fantastic on all new home construction, which will essentially reduce 3 tons of greenhouse gas emissions on each new home that's built in this municipality. Our other policy, which has turned out quite well, is our LEED policy, Leadership in Energy Environmental Design. LEED is something that will be applied to all new industrial, commercial, and facilities. And also we're working on a program right now with our new official plan to incorporate LEED neighborhoods to complement the Energy Star program. Our Thinking Green program deals with any environmental policy, big or small, and really has been something that's been viewed within this region as effective and something that people are really starting to jump onto. Looking at East Gwillimbury over the next number of years, we're going to experience some significant growth. About 22% of our land mass at this point in time will go to new urban enhancements. Between 75 and 80% is going to remain green. That's the great thing about the town of East Gwillimbury. We truly will have the best of both worlds. Being in a community like this where you can have those urban amenities and at the same time experience the green space, the agricultural lands, and the opportunity to not have to travel miles to still get a piece of the country, you'll be able to do that here. And that is what really sets us apart from everyone else within our region, and in many respects, probably this province.
Our plans are now underway. As you plan your future, we ask you to come and join with us and help us complete our community.